discussion on COVID, we can see that data and ethics march in a parallel way, not the same way, in a parallel way. For example, in the recent PRB PAC meeting on October 26th at FDA concerning vaccines to 5 to 11 years old, experts were called to vote on the question if, basing on EBM, do the vaccine benefits outweigh the risks? And this was the question. But the CDC epidemiologist, Fiona Habers, have presented not only pure data, but also considerations about the opportunity to give the vaccine. And the chairman of the meeting, Professor Arnold Monto, you believe, warned that in case of negative vote, many vulnerable children would be left without the vaccination coverage. Now, is this approach an EBM approach? I mean, is it correct to take a decision on opportunity more than on safety of the vaccines? The point is that if ethical approach is admitted in this case, it should have also to be admitted when some scientists say that vaccination for kids is useless. I don't know if I was clear.
Yes, it's a very complicated field, and I have to say that I have published a paper in the European Journal of Clinical Investigation specifically on vaccination of children and also university students. And my aim was to describe what we know, what we don't know, how much uncertainty there is, what are the direct benefits and harms, and what we know about them. What are the potential indirect benefits and harms, because we have to consider those as well. And in a way, they may be even more important in terms of numbers of deaths averted, but there can be arguments on both sides, as this being beneficial or that being harmful. And what are some bigger considerations? So I avoided saying that you need to do it or you should never do it, because I think that people should be told about what is the evidence, what we know, and then reach what I call shared decision making. You know, this is at the basis of evidence-based medicine. Evidence usually has uncertainty. I would say it always has uncertainty. There's things that we don't know, or even for things that we know, they have some confidence intervals that sometimes they can be pretty large. For example, if we talk about harms, myocarditis, which is the harm that we worry about in children, is something that we have some evidence based on reporting of virus and other surveillance systems, but we also know that these surveillance systems are under-reporting, under-capturing that problem. So then the question is, what is the correction factor? How many times you need to increase that to understand the real absolute risk? And anyone who says that I know the exact correction, probably is telling a lie. We just don't know that. We make some speculations. Same thing for several of the harms. We still have big gaps. I mean, we know how many children died, but when we go back, we see that many of the children who are coined as COVID-19 deaths or COVID-19 hospital infections, actually they had other reasons, and maybe they're not really COVID-19 deaths. We have a very difficult time to separate exactly what happened and exactly what is the benefit that we're expecting to have. We have uncertainty about how big the next epidemic wave will be. So if we vaccinate, if there's no epidemic wave, no children will be affected, then the benefit is not there. Conversely, we have a very active epidemic wave, it makes a very different story. So there's all of these uncertainties that it's important to communicate to parents and tell them this is what we know, rather than try to reach some kind of black and white decisions.
But to go to school, it's quite...
To go to school, I think I would never close schools.
Many schools ask for vaccinations, and
this is... I'm not in favor of mandates. I do not believe that mandates really improve in the long-term compliance with effective public health measures. They achieve some short-term benefits, They're good for someone who wants to make a claim within a month or 2 months that some number has improved. But I care about humans. I don't care about just single numbers. I care about saving lives. I care about maintaining social cohesiveness. I care about people maintaining trust in public health and not feeling that they're oppressed to do something. So I believe that schools should remain open. I think it was a big mistake that we closed them, even before we had vaccines, actually. Now that we have vaccines and we have other measures, even less so. Should that mean that we should mandate vaccination for children? I don't think so. I think that parents who want to vaccinate their children, that's beautiful. They can do it, they should do it. Those who do not want to vaccinate their children, I think that this is equally fine. I would worry about creating more tension in a society that already has a lot of tension. And ending a pandemic is not just an issue of decreasing the number of deaths and the number of cases. It's equally important to decrease the tension. If we have 0 deaths, but we have animosity and tension and hatred and divisiveness and people being marginalized, with 0 deaths, we are still in the middle of a pandemic, even though deaths have, disappeared.